There we go. Joining me now is Dr. Ryan Jennings, the Chief Medical Officer of HSHS St. Anthony Hospital. Good morning, Ryan.
Hey, good morning, Gail. How are you?
I'm great. How are you doing?
Not bad, not bad. I wish we could get some sun to break through, but that's all right. At least it's warmer.
That's right. It's not snow and ice, and anytime it's not snow and ice, I'm going to take it.
Yep.
We need some dry weather for the farmers, but, that's what it's like living in this part of the country.
Yeah, no doubt.
Yeah. So how are things going at the hospital and in this part of the country, Ryan?
On the whole, we continue to kind of be cautiously optimistic. We did resume some of the elective surgeries, and hospitals in the area have done the same, and really statewide, and understanding how to do that safely with making sure that we're testing, making sure that we're screening visitors as they come in, and support people for those having surgery, and making sure that they don't have fever or anything like that as they enter the building. So, I think the key element is as we open up, quote unquote, whether that's specifically related to the hospital here or out in the communities as folks kind of battle their way through decision making around how to safely open up. A lot of it is just being smart and continuing to be cautious, continuing to wash your hands, not touch your face, wear your masks, those types of things to keep us all safe. But knock on wood, so far so good. And even with introducing testing to all the patients having surgeries around the region, we've not seen a lot of positives popping up in that population. And so that's encouraging that hopefully there's not a lot of folks that are asymptomatic that are actually carrying the virus right now. So I think that's good news as well. And of course, you've seen a lot more testing in the state as they've ramped up additional testing facilities for surveillance, like the tent back behind Building A now on Temple Street, where they've started to kind of screen all essential workers, whether they have symptoms or not, as an option. And even with that, not seeing a big uptick, which is, again, reassuring that hopefully we're not going to see as much general prevalence in asymptomatic people as what perhaps we feared.
Yeah, because we really thought, everybody thought that once that additional testing was available and being done, that we would see a huge uptick in cases.
And I'm sure we'll see some, but like I said, to your point there, it doesn't appear to be huge, or we would have already started to see higher prevalence. Statewide, I want to say that they're estimating the percent positives is around 14% or something like that, but within the county itself, it seems to be lower than that. And of course, that isn't a surprise. I mean, you've got a lot more, although you've got more population, in the larger areas, there's only a certain amount of testing being done, and as that's going through their communities, they're going to have more frequent positives, and, down here, hopefully, we'll continue to have the blessing that we've had so far, and a lot of great work by folks to keep it that way.
Absolutely. Boy, I'm telling you, as I mentioned right before we went on the air, I certainly am glad I'm not the one in the position having to make the rules. I'm not nearly smart enough to do that, and I would not want that weight on my shoulders.
I'm not sure I'm smart enough, but I think it's about how you try to do it safely, and I think that's where you're seeing the county and the city and everybody in the state and really the nation trying to talk about how do we continue to be safe and follow the precautions that make sense. Some of the states that have opened more than Illinois have been successful partly by just being very careful around their high-risk population. So being very careful around the elderly, being careful around those congregated living facilities, and still having quite a lot of caution when you're allowing any entry into those facilities, because a single case, of course, becomes devastating and can affect literally dozens of very vulnerable people very, very quickly. And so, as we get the opportunity maybe to be outside a little bit more and be around friends a little more, we still need to be thoughtful about whether or not we're vulnerable for some reason as an individual. If I have a medical condition that raises my risk, I need to be more mindful of myself and my own well-being than someone who has no medical conditions. And similarly, as you're going out to see folks, if they're a high-risk population, they're elderly, those types of things, that contact still needs to be minimal. So if we're going to be successful in kind of safely reopening around this, we're going to do that because we pay attention to who's vulnerable and try to continue to keep them safe.
I did hear on the news this morning that they had tried a vaccine on 45 people, and it was very successful.
I saw that as well, and some encouragement there. I know they're putting lots of resources towards vaccine development, and the great news is, that at least the phase 2 piece of that looks to be very promising, and that's great. Unfortunately, I kind of laugh as they're trying to say they're going to force this timeline to get this vaccine out, and it may still happen in record time, but there's still a certain amount of just the human body only does something so fast. Whether so when you vaccinate them, you still got to wait on the body to make an immune response. You got to be able to measure that. You got to be able to have them be exposed and then retest. And so we don't have ultimate control over this timeline.
You can't push Mama Nature.
You cannot, especially in these circumstances. And if you make the mistake of jumping to a conclusion too soon, then you potentially cause harm. And of course, at the end of the day, that's what we don't want to have happen. So I appreciate the urgency around it, and I definitely believe that there's more resources being put to this than perhaps anything in the history of medicine. And we've been very fortunate to be incredibly successful with vaccine programs. In fact, just 2 or 3 days ago was the first time a smallpox vaccine was administered in the world back in the 1700s, and today smallpox is eradicated from the earth. So so there's a lot of really smart people working towards that goal, but you can't force the timeline.
No, you just can't rush something like that and be safe. I do have a question that has been on my mind, and I know every year we have a flu season. I mean, you can expect it. It just happens every year. Oh, pardon me. Frog in my throat all of a sudden. I apologize. And every year, then the flu season is over. Is there any chance that is going to happen with this, Ryan, or is this a totally different animal, right?
It is a totally different animal, although your comments are spot on, and part of why this is dragging out maybe longer than what we would normally think about. I mean, although reality is we normally would think of flu season even, October through March. I mean, you're talking about, 6 to 7 months.
Right.
We're really not even quite that far into this yet, with the first cases, where it got to be a big deal. We're not quite that far yet. But remember, what we've done by bending the curve or flattening the curve is actually prolonged how long it will be out there. So we intentionally, have tried to reduce the number of people that get infected all at once so that we don't accidentally overrun the healthcare system with thousands of sick people.
All at once.
All at once, exactly. But at the end of the day, more or less the same number of people will eventually get sick. I mean, it'll be somewhat less, but you're still going to have a certain number. And so the infectivity will persist in the community longer because of the delay and when we start to see increased immunity, which is, way back when we first started talking about this and talked about how that RO value, that, when one person goes out, they can infect up to X many people.
Right.
And that number over time goes down as more people become immune. And so, instead of reducing the number of people that can potentially be infected by sheltering in place, eventually as more people are immune to it, that number goes down naturally. And then once that number gets below 1, the disease kind of burns out. So that if you go out in the community and you're not going to infect even one person, you can imagine then it slowly disappears. As long as that number is over 1, then you're spreading it, potentially, and it'll string along. And so one of the downsides of flattening the curve is, in fact, prolonging how long it's going to take before we start to see that level of immunity where the disease kind of disappears. And, this year's flu season seems to be completely over for all practical purposes at this point. You see a one-off here and there, but really it's gone.
That is, you just confirmed exactly what I had been thinking myself. I'm surprised that I came up with something that intelligent. I surprise myself some days, and other days I try to get out of the car with my seatbelt still on. I do that quite often, a couple of times a week. So now my other question is, and I hope I want folks to know I'm throwing these at you completely unrehearsed. Will this mutate? Because I know the flu mutates yearly. Is there a chance of this mutating?
Oh, absolutely. I mean, I can't imagine a bug that's out there that doesn't always, be mutating and trying to transform. But similar to the flu, as you make that analogy, there are some years where the virus mutates very little, and so you carry some immunity over from year to year, and minor changes in the vaccine and things like that make the vaccine still very, very effective. And of course, we've talked before that there were several strains of coronavirus that we were already aware of, and kind of ran in the background and caused respiratory illness, but not necessarily one as severe. And so what happens every so often is rather than getting what's called antigenic drift, where there's just a minor change in the virus from year to year, where it just gets a little bit different. So some people that normally maybe would have been immune get it, but it's not a big change because the body still recognizes it and starts to attack it. You get it what's called an antigenic shift, meaning it takes a major mutation. And so some years you see these flu pandemics, like the 1918 pandemic or the swine flu that we had here a few years ago, where the virus changes very, very dramatically, and then no one has immunity out in the community or even lower levels of immunity because of similarity in the virus from year to year, and so suddenly it takes off and spreads like wildfire. Well, so this is very similar to that concept where the virus took a major change in its structure. Hopefully, you normally don't see year after year after year of a sudden major change like that, so hopefully if this virus behaves like most of them do, you'll see some drift from year to year so that there's some level of infectivity that persists out there in the community. This isn't going away, in any real form, but does it become something that is kind of prevalent out there, but again, not overrunning the healthcare system, and we're able to function back in society safely.
So, in all hopes, this will be the worst year.
That would be my hope. I know it'll be everyone's hope,
Exactly.
But and of course, we just don't know, and
right.
So many of the things with this one, unfortunately, are unknown. But I do think, as we've seen, kind of how this has progressed, there are an awful lot of parallels between how this virus is behaving and how the flu and many of the other viruses that we've dealt with year over year behave. So I don't know why this one would suddenly be dramatically different.
Oh, well, such excellent information, Ryan. We appreciate this so much. It's so good to hear that y'all are getting back to a bit of normalcy with the elective some of the elective surgeries and procedures, and that's good news. That's hopeful.
It is, and really the ticket to ride for that, as well as out in the community, is being thoughtful about how to do it safely. We didn't just throw our doors open. No hospital just threw their doors open and said, let's do business as usual.
Right.
We're continuing to put safety practices in place, and I think that will be the key to success in other areas outside of healthcare as well, that people still need to be mindful of how to be safe and how to be very careful around vulnerable populations.
Fantastic. Ryan, you just don't know how much we appreciate you taking your time, because I know you've got more than your share on your plate. And it just means so much to us here at WCRC and Cromwell Media and all of our listeners for you to take this time to update us on this every week.
No, it's truly my pleasure, and many thanks to WCRC for giving me the opportunity.
Thank you, Ryan. Take care, and you be safe.
You too. Bye-bye.
Bye.